Frequency-specific microcurrent is a new paradigm using frequencies and the power of resonance as holistic support for health and wellness. FSM, or frequency-specific microcurrent, doesn't really make any claims about being able to diagnose, cure, mitigate, treat, or prevent any condition or disease. The statements and techniques taught in an FSM seminar were inspected by the FDA, the regulatory authorities in the United States, and no changes to the material were required. The use of frequencies as a therapeutic tool hasn't been evaluated by the FDA, and FSM has always been in compliance with FDA regulations. In this presentation, I'm a clinician sharing my clinical experience with other clinicians in order to encourage education and research of novel techniques as a matter of free speech. Patients listening to this should also be aware that they need to collaborate with their medical providers about using FSM as an adjunct to improve health and wellness as part of a holistic approach to treatment. So you have to ask yourself, what would happen to your life and your health if you could reduce inflammation and stress, reduce pain, and increase cellular energy by 500% with a treatment? Quickly, without drugs or side effects, and there was a reasonable mechanism of action and some published data. Frequency-specific microcurrent is that. It is a new tool you probably didn't know you needed that does something you didn't think was possible. So where did it come from? Frequency-specific therapies were developed in the early 1900s by medical physicians and osteopaths in the US, England, and Germany, and used by thousands of physicians until the late 1920s. I think they finally stopped in 1934. In 1910, the Flexner Report came out. This was Abraham Flexner, and suggested that medicine should become standardized by establishing standard medical education, reducing the number of medical schools, and eliminating non-pharmaceutical, unscientific approaches. This was the beginning of standard pharmaceutical medicine. The effects of the Flexner Report weren't fully implemented until about 1927. When it comes to medicine, you have to remember that we're talking about a profession that took 50 years to learn to wash its hands. So frequency-specific therapies were developed in the early 1900s, but medicine, after the Flexner Report, labeled them electromagnetic therapies as ineffective fakes. I think they used the word quackery, which is pretty funny. Drugs and surgery would be the only tools of medicine. Nutrition, herbs, homeopathy, and frequency therapies were outlawed in every healthcare intervention except for prescription medications. Surgery and radiation was outlawed. So the physicians who used these tools would lose their license to practice, which at that time was granted by the American Medical Association. The research and history were lost. Look at this library. The physician who did the research as part of the Electromedical Society, their Pathometric Society, or who published his findings in Electromedical Digest, when this man passed away, what happened to his library? The research and the history were lost when these researchers and clinicians died. Practitioners were persecuted, and a few even were put in jail. The devices went in the trash or sat in the back room of a clinic with a sheet over it. Harry Van Gelder was an osteopath and naturopath from Australia and the UK. He bought a practice in Canada in 1946, walked in the back room of that clinic and found a device under a sheet that was made in 1922. Well, the sheet wasn't made in 1922. The device was made in 1922. That device came with a list of frequencies. In 1983, George Douglas worked with Van Gelder and brought home a copy of the list of frequencies and put it in a drawer and forgot about it. And the list looks something like this. There was one channel where the list named conditions such as allergy reaction, inflammation, scarring, and a second channel to target specific tissues, the spinal cord, the arteries, the connective tissue, the nerves. This is Harry Van Gelder, and this is a picture of George Douglas. So microcurrent was approved in the category of TENS devices in 1971. Dr. Douglas found the list in a drawer in 1995 when he moved, and he shared it with me when I first started my practice. He suggested we use the frequencies with a 2-channel microcurrent machine like this. It was exactly this, precision micro, because Van Gelder's old machine had 2 channels. Because of the loss of history, we have no idea how the frequencies were divided. Uncertain of the mechanism of action. 1920s equipment was not microcurrent. In the 1920s, therapy was not FSM. So I first used the frequencies in 1995 on patients with muscle pain. And 1996, I treated 150 new patients with myofascial pain. And in January of 1997, I taught FSM for the first time to find out if the effects were reproducible. Turned out by June of 97, we knew that the benefits and the effect were not only teachable, they were reproducible. And since then, research in animals and humans and clinical results have accumulated over the last 30 years. At this point, we have 20 peer-reviewed papers, a medical textbook published by Elsevier, and a consumer book published by North Atlantic Books and Penguin Random House. Right now, there are 5,000 FSM practitioners or more in 23 countries around the world. So 2 channels, 2 frequencies. Van Gelder's system used 1 frequency to resonate with the tissue and 1 frequency to resonate with a condition that caused interference with the proper function of that tissue. The theory was if the interference was removed, then the tissue would return to its normal state of balance and function. Clinically, the use of frequencies is low risk. We spent a year, 2 years making sure it wasn't a placebo effect. And what we found during that time was that the frequencies either worked or they didn't work. If they didn't work, they just didn't have an effect. There was nothing for them to resonate with. So the frequency just went right on through. Side effects, such as when you increase range of motion in the neck by 40%, sometimes a bone spur will poke into a nerve and give you nerve pain in your thumb. That goes away when you treat the nerve, or it goes away by itself in 24 hours. The course for FSM lists every precaution and contraindication that I can think of. Fortunately for us, medicine's pragmatic. Medicine asks, does it work? And figures out the mechanism of action later. They used willow bark for hundreds and hundreds of years and aspirin for 100 years and had no idea why it worked until Upjohn developed ibuprofen and elucidated or understood how prostaglandin chemistry worked as ibuprofen was developed. It's worth noting that over 80% of the medications in use today, as listed in the physician's desk reference, they will have a statement in there that says the mechanism of action is not known, not well understood, or not proven. There are very few medications where the mechanism of action is clearly understood. So FSM works by way of resonance. Okay, what's resonance? Resonance is the tendency of a system or a bond to oscillate at large amplitudes in response to some frequencies and not others. At the resonant frequency, very small forces can produce very large amplitude vibrations. In the 17 or 1800s, they found out that soldiers marching in step could create a vibration in a bridge that would harmonize with or resonate with the bonds that held the bridge together. And the bridge would simply come apart because the soldiers were marching in step. To this day, soldiers break step when they come to the beginning of a bridge and go back into step when they get across. When a singer sings that sustained, perfect note that breaks a lead crystal glass, that works because there's a precise frequency that holds lead atoms together in a 70% lead crystal matrix. The lead atom bonds have a frequency that holds them together that's within the range of the human voice. So if the singer's note is precise and sustained, the lead atoms start to vibrate because they resonate with that note, and they vibrate so much that the lead crystal just comes apart. Resonance is incredibly powerful. This is the Tacoma Narrows Bridge. I think it was built in the 1930s from the look of the cars. It was a design where the bridge was thinner and more flexible. And it's built in the Northwest, and in a normal Northwest rainstorm, light winds, 20 miles an hour, the bridge began to sway. And when the swaying reached the resonant frequency of the bonds that held the bridge together, the bridge came apart. And if you'll notice, these standards were equal distant from the headlands to the standard and from the headlands to the standard. So it created a perfect sine wave when the vibration started. Resonance destroyed the Tacoma Narrows Bridge, not the force of the wind. So how does that relate to human physiology? It's physics. Newtonian physics describes large objects. So if you drop weight off of a building, it will accelerate at 32 feet per second until it hits the ground with a predictable force. But Newtonian physics falls apart at the molecular level. Your body is a large object made of molecules, atoms, and subatomic particles. And those are held together by electromagnetic bonds. So quantum physics is the word that's used to describe the action of molecules, atoms, and subatomic particles. So you are a Newtonian object with a quantum physics structure inside. And it's worth noting that every chemical, electrical, and mechanical bond has a frequency at which it resonates. So this is insulin in your body. But look at it. It's made of molecules, atoms, subatomic particles held together by electromagnetic bonds, right? So the human body is a quantum biological system because living tissue is biochemicals held together by electromagnetic bonds, and every bond has a frequency at which it resonates. Now, how does current flow inside your body? Water lines the gel that's inside cells and forms structures that act as a semiconductor. Your cells are not a little bag made of water. It is lined with a gel, and water molecules attach to that gel, and they vibrate inside the cell and in the water and blood and liquids that flow in your body. And as they vibrate, they leave space for an electron that makes every cell in your body act effectively like silicon in your computer. And this makes each cell and all the fluids in your body into semiconductors. So your body's an electromagnetic system that looks solid, but the cells function as a semiconductor network, conveying current, charge, and information. Now, biologic resonance explains the effects of frequencies on living tissue. First, let's talk about drugs or nutrients. They act like keys in a lock to change membrane receptors and intracellular function. So this receptor on a cell is sensitive to circulating inflammatory products, pathogen-associated molecular patterns, PAMPs, damage-associated molecular patterns, so bits of tissue from injuries that land on this receptor and stimulate kinases that stimulate transcription factors, that stimulate the genes, messenger RNA, microRNA, to cause the cell to produce inflammatory cytokines or prostaglandins. Okay. We are used to, let's say, ibuprofen. Ibuprofen interacts with this receptor like a key in a lock, changes the behavior of the cell, and turns off the ability of the cell to make, or reduces the ability of the cell to make pro-inflammatory cytokines. Frequencies appear to act like your key remote instead of key to open the lock with an electromagnetic signal. That's biologic resonance. The frequencies appear to change membrane protein configuration and cell function electromagnetically with a specific frequency signal. Frequencies act as if they change cell signaling and act as if They dissolve scar tissue crosslinks by resonating with the bonds in the receptor, the way your key fob opens your car door at a distance instead of using the key. And you notice that your key fob opens only your car, even if there are 12 identical cars in a row. And that's because your car has a specific single frequency that's tuned to that key fob. FSM seems to work like that with specific problems in specific cells. So how do we know that frequencies affect biological tissues? It's the basic principles of science. First, you observe something. You do this, and that happens. And then you measure it to make sure that what you thought you observed really happened. And then you do it again. And then in a similar situation, you predict that it might happen again, and then you observe that it does happen. The second basic principle of science is you can't throw out the data because it doesn't match your model. The third basic principle is you change the model and start over. And that's what we did with FSM. We had animal research in 2003 at the University of Sydney. And we found, Dr. Vivian Reeve found that the frequency to reduce inflammation in the immune system reduced lipoxygenase-mediated inflammation by 62% in 4 minutes. Half of the response was there in 2 minutes. The other half was there at 4 minutes. They paint arachidonic acid on the mouse's ears. The mouse's ears swelled up. They're measured with calipers. You do something to the mouse. You run 40 and 116. And you get a 30% reduction in COX-mediated inflammation, which doesn't sound as good, but that is equivalent to injectable Toradol when it was measured in the same animal model by the same researcher. These results were so dramatic that she made a blinded trial, put in a placebo frequency, and the results were still 62% reduction in LOX, 30% reduction in COX, and only with the frequency 40 and 116. The current by itself had no reduction. Other frequencies from our list, no reduction in inflammation. And other frequencies from our list, no reduction in inflammation. We had stumbled across or guessed at a frequency combination to reduce inflammation in the spinal cord in fibromyalgia patients who had their fibromyalgia associated with spine pain, spine injury. 40 hertz on channel A, 10 hertz on channel B was the frequency from the list for the spinal cord. 40 hertz was the frequency to reduce inflammation. Everybody had their pain reduced from an average of a 7.4 to a 1.3 in 90 minutes. And when we had blood work from the National Institutes of Health, I'll show you the data. All of the inflammatory cytokines were reduced in 90 minutes, and 58% of the patients recovered from fibromyalgia in about 4 months. So the inflammatory cytokines, interleukin-1, TNF-alpha, interleukin-6, all were reduced with p-values. These are very statistically significant. They dropped at a 45, 50, 70 degree angle. Substance P is produced in the spinal cord. And when that dropped with a p-value of 3 zeros and a 1, we knew that 10 hertz was really, in fact, addressing the spinal cord. Endorphins go up, the patient gets floaty, and the pain was reduced from a 7 to a 1. Now, in medicine, inflammatory cytokines are hard to change, and once they change slowly over months. But 40 hertz reduced all inflammatory cytokines by 10 and 20 times in 90 minutes. And when they came back at the second visit, they came back at reduced levels. How can a frequency do that? After 15 years with physicists, microimmunochemists, and physicians passing information back and forth, looking at papers, it became obvious that the only way that all of these substances could change at one time is if we were changing cell signaling, is the only thing that could normalize them all so quickly. So the data suggests that cell receptors respond to frequency signals that turn inflammation off. You can't throw out the data because it doesn't match your model. Frequency-specific microcurrent is not about the device. It's about the effect of the frequencies. So how can specific frequencies change conditions in specific tissues? So the changes are immediate. The tissue everywhere softens. The changes in sensation. The pain goes down. Some patients feel warmth, and then this stops when the frequency is finished. And sometimes there are lasting effects. So how does science explain the observed effects of FSM? The first thing you need to know is that microcurrent, just the current by itself, as long as the current is below 500 microamps, just the current increases ATP production by 500%. It increases protein synthesis by 70%, amino acid transport by 40%. It increases cyclic AMP, which is part of the energy cycle in a cell, and it activates signal transduction, enhances communication between the cells. And this is published in 1982, repeated in 2001 and 2002. So FSM changes tissue very quickly, but it needs manual and exercise therapy for physical changes, nutrition and lifestyle changes, sometimes even medication for lasting and permanent results. FSM is part of a strategy to improve health and wellness. Now, this stable state that FSM creates immediate changes, but what gets the changes to last? If you look at water is perfectly stable as ice as long as the surrounding environment is 0 degrees centigrade. It's completely stable as a liquid as long as the surrounding environment is between 1 and 99 degrees centigrade. When you get to 100 degrees centigrade, it's completely stable as steam, right? The correct frequencies create instantaneous changes that change the state of the tissue. And those changes can be permanent when the patient's metabolism, attitude, mechanics support the change in state. And the stable state in a human system depends on biomechanical factors, how conditioned the patient is physically, general health, their nutritional, emotional stress, toxicity, infections. There are a lot of things that have emotions. There are a lot of things that affect health and the stable state in a human system. So frequency-specific microcurrent has been established since 1997. It's low risk, it's reproducible, teachable, reliable, non-invasive. The current is current you can't feel. It's physiologic, the same kind of current that your body produces on its own. So this is a patient that had a diabetic wound. This is not published, but it's been replicated. He had a 7-centimeter ulcer on the side of his leg. He had sensation loss in 7 out of 10 areas on his foot. All of this was healed in 6 weeks and between 6 and 11 treatments, and you hook the current up from the knees to the feet. So there's this necrotic toe, and at the end of 6 weeks and 11 treatments, it was better. We have a published paper in the treatment of acute shingles. This was an 85-year-old man with shingles in the ophthalmic branch of 5. It took 4 hours of treatment. There was one frequency pair in 2010. He was pain-free in 1 hour. The lesions were gone in 2 days. Virus is mutated, so now it takes 3 pairs to be used for 20 minutes apiece for a 1-hour treatment. And that treatment needs to be done once a day for 3 days. The first paper published was in 1998 in myofascial pain or muscle pain, 5 years chronicity. 88% of the patients had failed to 3 to 6 other practitioners. So the patients were their own controls. If they were going to have a placebo effect, they would have had it with one of the 3 or 6 other practitioners that treated them. It took 11 visits and 8 weeks for their starting pain to go from an average of a 7 to an average of 2. And that was published in 1998, published low back cases in 2004. 8 years chronicity, range was 2 months up to 20 years. 87% failed with 6 other practitioner traps. And then it took 6 visits and 6 weeks along with exercise, prescribed exercises, for their pain to go from an average of a 7 to an average of a 2. Treating neuropathic pain is very difficult in medicine, and in FSM, it's the easiest thing we treat. Average chronicity for these 20 patients was 7 years, 6.7 years. All patients experienced pain reduction. Their pain in the first treatment went from a 6.8 to a 1.8. It came back up to about a 5, but then it went back down to a 1 on the second treatment. 65% fully recovered in about 5 sessions. One patient got better in 1 treatment. One patient, it took 15 before it was permanent. There were no adverse reactions except they get sleepy. 25% terminated care prior to recovery. And if you've been in pain for 7 years and you are out of pain in 90 minutes, it has the ability to create an identity crisis that's pretty much unparalleled in medicine. Who are you if all of a sudden you don't have nerve pain after 7 years of being in constant pain? This was a patient who was 19. He had ulnar nerve transposition surgery. The surgery produced no change in pain or range of motion at the age of 28. So 9 years later, his pain was a 5. Taos is a functional score, so he was 86%. 100% is full function. He had 11 physical therapy sessions. His pain went from a 5 to a 4, and his Taos went from 86 to 92. 1 year later, his pain was a 7, and his Taos was down to 80%. He had 3 sessions of FSM, treating the nerve for inflammation and treating the nerve for scar tissue. And at the end of 3 sessions, his pain level was a 0. His Taos was 100%. And the results were maintained at 1 year with his pain at a 0 and his Taos at 100%. Neck and low back pain. This was a retrospective case control study done in India. They compared pre and post-treatment numerical pain rating scores, Oswestry disability, which is a functional score. And in low back pain, the p-value was 0.005. FSM, 0.006. In neck pain, they didn't find a significant difference. I found out talking with the authors that they had used an incorrect protocol, so they're going to read you the neck section of that study. It was published in 2020. Delayed onset muscle soreness is the one blinded trial we have. There was alternating current. These were the frequencies that were done. There's a frequency to stop bleeding, treat the tissue for tissue damage, reduce inflammation. And this compared frequency-specific microcurrent with non-specific microcurrent. That was published by Allen in 1999. And plain microcurrent does not have an effect on delayed onset muscle soreness. The frequency-specific microcurrent, the treated leg at 24 hours. So you do exercise that is guaranteed to make the hamstring sore. So the treated leg at 24 hours was 1.3. The sham leg pain level was a 5 out of 10. At 48 hours, which is normally the worst, treated leg was a 1.2. The sham leg was a 7. And at 72 hours, the treated leg was less than 1. The sham leg was a 4. P-value with an N of 20 was 0.0005 at all time measures. The thing with delayed onset muscle soreness is there's no other effective treatment. We did a project at a burn center in Springfield, Missouri, treating scar tissue in burn patients. And this is a non-published, but it gives you an idea of what can be done with reducing scarring. This patient had a full thickness burn. Before treatment, his elbow was stuck in 15 degrees of flexion. After 1 hour with FSM used for scarring, his elbow was able to be completely straight, and that was permanent. So what would happen to your comfort, your health, and everything you do if you could reduce lipoxygenase-mediated inflammation by 62%, COX-mediated inflammation by 30%, reduce all inflammatory cytokines, and increase cellular energy by 500%? FSM is a new tool you probably didn't know you needed that does something even I sometimes don't think is possible. And frequency-specific microcurrent is taught these days in a 5-day core seminar, in person or on video. It's lecture, and if you come in person, there's 9 hours of hands-on practicum. You get individual attention with myself, and there's 1 instructor for every 6 students. You have immediate competence. When you leave Sunday night, you are overwhelmed, but safe and ready to start treating patients the next day. It's a pretty steep 3-month learning curve. There are advanced courses, webinars, workshops, lots of continuing ed for those of you that like to learn more and want to advance. If you go to frequencyspecific.com, you can sign up for a seminar and learn more about seminars. If you want to know how FSM was developed, The Resonance Effect was published by North Atlantic Books. You can get that at frequencyspecific.com/book or go to Amazon. It's published in English, French, German, Polish, Mandarin, and I think that's it. We're working on Japanese. It's a fun book. But I have to warn you, frequency-specific microcurrent may change your life, your health, forever. I encourage you to go to frequencyspecific.com and explore the power of frequencies and FSM to support a holistic approach to health and wellness.